The word tuberculosis sounds long and frightening, but its roots stretch far back into ancient languages and even deeper into human history. The name comes from the Latin word tuberculum, meaning a small swelling or lump, referring to the tiny nodules that form in the lungs of infected people. Centuries before science understood bacteria, healers saw the mysterious wasting illness that slowly weakened its victims. They called it consumption, the White Plague, and believed it was caused by sadness, bad air, or even curses. But the story of tuberculosis is not just a tale of suffering, it's a story of discovery. Progress, courage, and the modern fight that is bringing the world closer to defeating one of the oldest diseases known to humankind. It begins thousands of years ago. Egyptian mummies show signs of TB in their bones, meaning the disease has existed for at least 5,000 years. Ancient Indian and Chinese writings describe symptoms that match TB: long-lasting cough, chest pain, weight loss, and fever. In the crowded streets of ancient cities, it spread silently, passing from person to person through droplets in the air, long before people understood germs. For centuries, families watched loved ones weaken slowly, not knowing that an invisible enemy, Mycobacterium tuberculosis, was living in the lungs, silently multiplying. Everything changed in 1882 when a German scientist, Dr. Robert Koch, made one of the most important discoveries in medical history. Using early microscopes and revolutionary techniques, he identified the bacterium responsible for TB. That moment was like lighting a torch in a dark room. Finally, people knew what they were fighting. This discovery opened the door to modern medicine, research, and eventually, treatment that would save millions of lives. Tuberculosis spreads mainly through the air when an infected person coughs, sneezes, or even speaks. But not everyone who breathes in the bacteria becomes sick. The body's immune system is a powerful defender, and many people inhale the bacteria yet never develop the disease. This is called latent TB. The bacteria are asleep, held back by the immune system. But when the body weakens due to age, poor nutrition, stress, HIV, diabetes, or other chronic illnesses, the bacteria can wake up and become active TB. That is why factors like age, gender, region, profession, and other diseases play such an important role. Older people, very young children, healthcare workers, miners who inhale dust, people living in crowded regions, and those with weakened immunity are more vulnerable. The symptoms of TB are slow and sneaky. A cough that lasts more than 2 weeks, fever at night, chest pain, weight loss, and weakness. These signs seem ordinary at first. So many people ignore them until the disease becomes serious. Some people develop TB in organs other than the lungs, such as the bones, kidneys, brain, or lymph nodes. But lung TB remains the most common and the most dangerous because it spreads easily. One powerful tool against TB is the BCG vaccine, developed in the early 1900s. Many countries give it to newborn babies to protect them from severe forms of the disease. Although it does not guarantee full protection against adult lung TB, it has saved countless children's lives over the last century. Vaccination remains one of the strongest shields in the global fight against TB, especially in regions where the disease is common. The real revolution in treatment began in the mid-20th century when antibiotics were discovered. For the first time in history, TB became a curable disease. Medicines such as isoniazid, rifampicin, ethimutal, and pyrazinamide formed the backbone of treatment. Doctors learned that TB bacteria are stubborn and require combination therapy, multiple medicines taken together for 6 months or more. If the treatment is stopped early, the bacteria can become resistant and much harder to kill. That led to drug-resistant TB, a major challenge even today. But modern science has brought new hope. Today, shorter treatment regimens are being developed, some lasting only 3 or 4 months instead of 6. New medicines like bedaquiline, delamine, and predamine are giving doctors powerful tools to treat resistant TB. Gene-based tests allow quick diagnosis, identifying TB and drug resistance within hours instead of weeks. Innovative vaccines are under development, and World Health Programs are bringing screening and treatment to remote areas through mobile clinics and digital monitoring. The global fight against TB is stronger than ever. Nutrition also plays a major role in recovery. A body weakened by poor diet is like a house without strong walls, cannot fight disease effectively. Patients with TB need balanced meals, rich in protein, fresh fruits, vegetables, milk, eggs, and whole grains. Vitamins like C and D support immunity, while minerals like zinc and iron help the body repair itself. Drinking clean water, resting well, and staying emotionally supported are also essential parts of healing. TB is not just a medical battle. It is a physical, emotional, and social one. In many regions of the world, TB remains common due to poverty, overcrowded homes, lack of health care, and poor working conditions. Workers in mines breathe dust that weakens their lungs. People who live in slums face poor ventilation, making it easier for TB to spread. Refugee communities, prisons, and homeless shelters also see higher rates. Gender plays a role. 10 men often develop TB more than women, partly due to smoking, workplace exposure, and delayed medical care. But TB does not discriminate. Anyone can get it, and anyone can recover with timely treatment. In addition to lifestyle and environment, other diseases greatly influence TB. HIV is the strongest risk factor because it weakens the immune system. Diabetes also increases the risk, as do kidney failure, cancer treatment, and long-term steroid use. That is why modern TB care checks for other health issues and treats them together. A healthy body is the best defense. As years passed, scientists and doctors realized that the fight against TB is not just a battle of medicines, it is a battle of awareness. People need to know the symptoms early. They need to understand that TB is curable, that treatment is free in many countries, and that completing the full course of medicine is critical. Education, support, family encouragement, and community health workers have become the pillars of recovery. Imagine a young man named Daniel who works long shifts in a crowded textile factory. He begins coughing, thinking it's just dust. Weeks pass, and he grows thinner, weaker, and tired. Instead of seeking help, he hides his symptoms in fear of losing his job. Finally, one day, he collapses while working. His coworkers rush him to a clinic where a simple test reveals he has tuberculosis. His world feels shattered. But then something unexpected happens. The healthcare team explains gently that TB is completely treatable. They give him free medicines, nutritional support, and counseling. A community health worker visits him regularly to ensure he takes his medicines and stays motivated. Slowly, Daniel begins to recover. His strength returns, his cough fades, and his appetite grows. Months later, he returns to his job not as a broken man, but as a survivor with a mission. He starts spreading awareness in his workplace, encouraging others to get tested early. Stories like Daniel's are happening every day across the world. Every person who recovers becomes a symbol of hope, proving that this ancient disease can be defeated. With modern treatment, proper nutrition, early testing, and strong community programs, the future looks brighter than ever. Today, the world stands at a turning point. Humanity has the knowledge, the medicine, the technology, and the determination to eliminate tuberculosis. Every successful treatment, every vaccinated child, every educated family adds one more step toward a TB-free world. The story of tuberculosis began thousands of years ago with fear and mystery. But now it continues with science, courage, and hope. And one day, because of the world's united effort, you may open a history book and read that TB was once a deadly disease, but no more.